Are there ethical concerns when psychiatrists prescribe medication? Imagine a doctor deciding what's best for your mind and well-being. It sounds simple, but when it comes to prescribing medication, many questions come up. Psychiatrists face unique challenges because their work involves the mind and behavior. They must balance respecting a patient's choices with the need to provide effective care. This balance is where ethical concerns often arise. One big issue is informed consent. Psychiatrists need to make sure patients understand why they are prescribing medication, what the benefits are, and what possible risks or side effects might happen. This can be tricky if a patient's mental state makes it hard to understand or decide. For example, if someone is severely depressed or experiencing psychosis, their ability to give clear consent might be impaired. Another concern is the risk-benefit analysis. Many psychiatric medications can have serious side effects. Some antipsychotics, for instance, have warnings about increased risk of stroke or death in older adults with dementia. Psychiatrists must carefully weigh the potential benefits of helping a patient feel better against the possible harms. Since the science behind how these drugs work is not always fully understood, this adds another layer of complexity. Off-label prescribing is also common in psychiatry. This means using medications for conditions that they are not officially approved for. While sometimes necessary, it requires the psychiatrist to be very transparent with the patient about the evidence and uncertainties involved. They must also monitor the patient closely for any adverse effects. Vulnerable populations, like children or people with severe cognitive impairments, need extra care. These patients might not fully understand or be able to consent to treatment. Prescribing medication ethically in these cases involves careful consideration of their rights, safety, and well-being. There are also societal concerns. Sometimes medications are overprescribed, especially by non-psychiatrists, or used when other treatments might work better. Psychiatrists have a duty to advocate for appropriate use and to consider non-drug options whenever possible. Transparency is key. Psychiatrists should be honest about what medications can and cannot do, including possible side effects and treatment goals. Building trust helps patients feel more comfortable and engaged in their care. In practice, this means psychiatrists conduct thorough assessments, involve patients in decisions, and keep a close on how treatment is going. They must be ready to change or stop medications if the risks become too high. Overall, prescribing psychiatric medication involves careful judgment. It's about respecting patient rights while making sure they get the best possible care. It's a process that requires ongoing communication, awareness of ethical principles, and a focus on safety and well-being.